You guys right to go? Got quite a bit to get through today, and I don't propose to be here for longer than an hour if that's possible. First things first, there are 1,438 new cases notified yesterday, all locally acquired. That brings us to a total of 11,018 active cases across Victoria. This is more than a 50% increase on yesterday's daily numbers, and I'm sure that'll be a great concern to all Victorians. We've been very clear these numbers would go up. They go up faster, of course, if people don't follow the rules. They go up faster if people are out visiting each other in their homes. That's not a sense of blame. It's not about trying to do anything other than deal in the facts. And what Jerome will speak about in a moment is some trends, very, very clear trends, from case interviews and from the data. Not guesswork, not the notion of blaming someone else. This is the reality that every single Victorian, including the government, faces. If people continue to visit each other in their homes, then they will bring the virus with them. They will spread the virus. And look, I don't think anyone necessarily who makes that choice thinks that they're going to be spreading the virus, but that's the reality of this thing. That is the reality of this thing. And 4 or 5 days after, the Thursday after a long weekend, and particularly given what we know from interviews over recent days, many of these cases were completely avoidable. Now, of course, they will add further pressure to our health system, and they will lead to more people being seriously ill. So I know it's frustrating. I know it's incredibly hard. I know this has been literally the longest journey, but we can see to the other side now. And that's why it's so important that we just find it in ourselves to do the right thing, do nothing to add to the spread of this virus, do nothing to add to the number of people who our nurses have to care for. And I know it's difficult. It's very difficult. We are all craving and longing for that personal connection, being able to spend time with each other, being able to get back to normal. There's nothing wrong with that. That is a perfectly natural thing. Pretending, though, that the rules don't apply to you, or pretending that I'll be fine, I won't catch this, and I won't give it to others, well, the data and the facts tell a very different story. We can't change what's gone on in the last week or so, or in many respects, at any point. That's all done. What we can do, though, as we head into another weekend, and as we get every day closer to that 70% double dose, we can all of us try and make the best choices possible for ourselves, for our loved ones, and indeed for our nurses who are there caring for patients. And it's not easy. It's very, very challenging work. Let's not any of us make that work harder by making the wrong choices. I can understand it. I can appreciate just how challenging this is, but that is one of the biggest drivers. It's not the only driver, but it's one of the biggest drivers with these numbers. I'm not trying to blame anyone. I'm simply trying to explain, because a lot of people will be scratching their heads today. How could it have gone up by so much so fast? Well, not theories, actual interviews. Actual interviews tell us that many hundreds of people, perhaps thousands of people indeed, have made some choices that meant they're spending time not in their own home but in someone else's home. And that's how we know this virus spreads. That's how this virus gets across the community. Now, I am saddened to have to report that there have been 5 people who passed away, a woman in her 70s and a man in his 80s, both from Whittlesea, a man in his 70s from Moreland, a man in his 60s and a man in his 90s, both from Hume. We, of course, pass our very best wishes and sympathies and sincere condolences to those families. This will be a very difficult time for them. Speaking of difficult times, any COVID patient who's in hospital is a challenging patient to care for because they have a wildly infectious virus. There are 398 people who are currently in hospital. 83 of those are in intensive care and 57 of those are on a ventilator. We send our best wishes to them and their families, of course, and we of course take this opportunity to again thank the many, many health professionals and the teams of people in our hospitals who are caring for them. They're doing their very best. There's some pressure there. That pressure is going to grow. I'm confident that we've got the resources that we need. We've got all the things you can control, whether it be machines and PPE and all the different consumables that you need to treat each and every patient. What is the biggest limiting factor is essentially fatigue. Our health professionals have had 20 months like they've never had before. That's why I keep making the point, let's not any of us, so no one in Victoria should be adding to the burden and the workload and the task that our nurses have right now and that they're going to have in the weeks and months ahead. That's the price of us opening up. Our hospitals are going to get very, very busy. But let's not make that any harder than it already is, because those nurses and doctors and ambos and all the team, they are tired. They are fatigued. They've had a very, very busy 20 months, COVID and non-COVID, as a result of all the other decisions that we've had to make. So let's not make their work any harder by making really poor choices and going and visiting mates and friends and family and taking the virus with us. That's what happens. Let's not be doing that as we look to these weeks to come. I am delighted to say that we have officially ticked over the 80%. We're at 80.3% first dose. We're at 49.5% second dose. Those numbers continue to grow. If you look at the New South Wales experience, once they got over 50% double dose, there was some inherent protection. It seemed a significant milestone in terms of driving down case numbers. I must say I'm very, very impressed with Hume, so the north and the west. So those northern and western local government areas where we've seen a concerted effort, really hard work on behalf of so many people, but we've made getting vaccinated in those areas a real priority, and those numbers have lifted strongly, really strongly, over the last couple of weeks, from in the sort of high 40s to 50% range single dose. They're now, I think, all of them above 70, and some are even doing better than that. So that is about saving lives. That gives people protection that they wouldn't otherwise have. So I want to thank everybody who's administering vaccines, everybody who's out there convincing people to go and get a vaccine, and of course people in the north and the west who've gone and made an appointment, whether it be with a pharmacist, with a GP, or coming to a state hub, or coming to one of the many pop-ups we've run. That is the best of work, the most important work. Beyond that, there were 34,323 vaccines administered yesterday, and just under 65,500 tests. So a very good test number, and another good strong vaccination number in our state hubs. And we again thank people for coming along and getting that done, and we thank the people who are doing that work, of course, and we extend our thanks to GPs and pharmacists as well. As I stand here though, there are 10,000 first dose Pfizer appointments and 8,800 first dose AstraZeneca appointments available in state hubs over the next 7 days. So 10,000 first dose Pfizer and 8,800 first dose Astra available in state clinics, state hubs. Go online right now, put your name beside one of those appointments, play your part and get us free, get us open, because you'll be helping to get us to 70% double dose faster. To that end, we now have, via a combination of discussions with General Fruin, discussions with federal ministers and the federal government and health officials, but across the board we now have the confirmed supply, if you like, a guarantee about supply. We have enough confirmation, we can be certain enough about what's coming to us throughout each of the weeks in October, that I can announce that we will, in state clinics, reduce the interval for Pfizer from 6 weeks to 3 weeks. That will come into effect from the 4th of October. The booking system will change from the evening of the 3rd of October. So if you're booked in from then, you will be able to book your second appointment at a 3-week interval if you choose to, as opposed to the 6-week interval. What that means is over the next few weeks, we will be able to have more and more people get not just 1 dose, but in fact complete their vaccination process with 2 doses. And that will help us to bring forward, or at least help us to deliver, and hopefully bring forward our 70% double dose target, which is still on or about the 26th of October. It's fair to say that we are confident, and when I say we, across the board, there is a degree of confidence, and the modelling tells us that we will hit that target. That's so important because that's when the lockdown ends. But anything we can do to bring that forward, even by a day or two, obviously helps. because the sooner we can reach that target, the sooner the lockdown ends, those reasons to leave home go, and we move into an entirely different phase. It's such an important milestone. So this interval change, because we have that certainty of supply, is an important part of that. That'll mean, I think, in essence, that hundreds of thousands of people who are currently waiting or will wait as a result of getting their first dose quite soon, they'll be able to get their second dose well before the 26th of October, and that helps to deliver that, but also potentially to bring that forward. There will be changes to the booking system. They'll be made overnight on the 3rd of October, so on the 4th, people will be able to make their second dose booking. I think I said, sorry, the 3rd, but it is the changes will be made on the 3rd, and the bookings will be able to be made with a 3-week interval on the 4th of October. That's very important. Now, beyond that, I just want to make a couple of comments. We've had Pharmacy Guild, and Jerome's going to talk about this as well, but we've had the Pharmacy Guild come along, actual pharmacists, people who are administering Moderna out in the suburbs, come and talk to you, and through you to the Victorian community. Some people perhaps don't know a lot about the Moderna vaccine. Moderna is not only safe, Moderna is effective. Moderna, as an mRNA vaccine, is absolutely critical to us getting this job done. People should have no hesitation whatsoever in going to their pharmacist and booking an appointment, going and getting the jab. All 3 of these vaccines work. All 3 of them are safe. All 3 of them, it's appropriate to have a discussion, whether it be with your GP or with a nurse vaccinator or a pharmacist or a doctor at one of our state hubs, which we provide for you. But there should be no sense of anything other than urgency to go and get a Moderna shot if that's what you can get first, or Pfizer, or indeed Astra. As we've said so many times, the vaccine you can get today is the best vaccine. The vaccine you can get today helps us to get to our 70% target, get the lockdown off, get free and open, and keep you and the people you love out of hospital. I just wanted to finish, before I throw to Jerome, to talk about not so much the outbreak map, but to talk about trends and to talk about what's driving some of these numbers. I just wanted to finally report that we've had some conversations with the Commonwealth today, and again, no sense of criticism, but as we had, I think, predicted at the time, it's very difficult for pharmacists and others to go from 0 to hundreds and hundreds of thousands of doses administered in the early stages. So we're very pleased to have said yes to the redistribution of some 88,000 Moderna doses. They'll come into Victorian hubs on Sunday, and we will get those out as fast as we possibly can. They will have to be delivered fairly quickly because they're not frozen. They've come out of the freezer, they're in the fridge, but they didn't get used. That's, again, not a sense of criticism. We're happy to receive those, we're happy to take them, just as we've taken many unused doses from GPs over the journey. And you'll see in our system, you'll see in state hubs, not just Pfizer and AstraZeneca, but there will be Moderna appointments available as well. I would encourage people, book with confidence, turn up between interval changes from 6 to 3 weeks and some of these additional supply issues that are coming to us. There's never been easier to come and play your part in protecting yourself and the people you love, and to come and play your part in getting us to 70% double dosed. And if it can be not the 26th, but a few days before then, well, that means the lockdown will end a few days before then, and that's great news for all of us. It'll also mean that 80 double dose is closer than it would otherwise be also. That's the nature of this, building and building day after day. That's why we're so grateful to all of those who've come forward and got a shot and their second jab. That's why we're so grateful to those who are administering this program in community pharmacy, in GPs and in state hubs. These numbers are higher than we would like. They are higher than they needed to be. I just ask people with an absolute sense of respect and an acknowledgement that it's hard and it's been a very, very long journey. But we can see to the end now. Let's all of us make the best decisions and not contribute to more virus, not infect people that we love, not make the work of our nurses harder. Let's just see this through. It's only a matter of weeks now, and then the lockdown will be off. That's what we have to be focused on, and then we can do things that are not allowed now, and for the very best of reasons. There's vaccination appointments available. Please go online and book one. Then turn up, play your part. These vaccination numbers are very strong. With extra supply, they can get even stronger. And hopefully we can bring some of those lockdown dates, the 70% and the end of lockdown, forward. But in the meantime, let's all of us not do anything that means more virus. Let's all of us be focused on not making the job of our nurses any harder than it's going to be. Jerome.
Thank you, Premier. Good morning. 1,438 new cases is a very challenging day for Victoria and a very challenging day for this particular outbreak. The surge, this event, the 50% increase in these numbers is down to a significant number of social gatherings over Friday and Saturday of last weekend. So we've seen over the last few weeks, of course, ongoing transmission within households, ongoing transmission between households, usually between close relations. What is different about the numbers today is that the activity 5 or 6 days ago, Friday, Saturday last week in particular, was quite different. The contact tracers tell us that there have been significant numbers of social gatherings on Friday and Saturday over a long weekend. Grand final parties, other social gatherings, barbecues, backyard visits. And all of this has generated significant additional caseload. So around a third of our cases today we think are due directly to those different types of social gatherings as people have dropped their guard and decide that it's a grand final weekend, it's a long weekend, we deserve a bit of a payback, we deserve a nicer time. And that has now translated into at least 500 additional cases from what we would have expected to see today. And we can see it not only in the contact tracing interviews, we see it in our mobility data, in our traffic data. We have had the busiest mobility, the most activity on our roads over the 3-day weekend of any lockdown weekend since the end of July. We're seeing a shift in the age profile. So in today's cases, 55% are men. It's quite a different profile to what we've seen for the rest of the outbreak. We're seeing a disproportionate increase in those aged between 20 and 29 and those aged between 20 and 50. So over 55, 56% of the cases today are in their 20s, 30s and 40s, again disproportionately high to where we've been before. And probably most notably, 6 out of 10 of the cases today are from new households. So we've seen a significant sparking off of new households, with the transmission jumping from known communities and known households into new, fresh territory. We can also see it in the sharp increase in cases in the southeast and eastern suburbs. So unlike previous days and weeks where we've been reporting a very static picture, now around a quarter of all of today's cases, 329 of them, are in the east and southeastern suburbs. And the map is far more diverse than before. We have a far greater scattering into new suburbs, new communities, new households that haven't been touched by coronavirus before in this or any of our other recent outbreaks. So we know that everyone's fatigued, we know everyone's tired of this, but today is a significant setback in how we manage this outbreak. It's a significant setback on our Burnett roadmap, and it's moved us, if this trend is contained, and of course we'll see that in the coming days. Today may just be one big rogue day that we all grip up together and drive back down, but if this trend is continued, and if we see similar case numbers over the coming days, then we'll go from being just below the mean on the Burnett projection, so we were tracking favourably over the last 10 days, we will jump to the worst quartile of those Burnett projections. Too early to conclude that now, and of course that's the work of our epidemiologists, but if that trend is contained, if we're seeing continued spread of these kind of cases over the days ahead, it'll have very grave implications for our nurses, for our ambulance workers, for our hospitals, and for people who need care, whether they need care for coronavirus or whether they need care for other purposes. This outbreak still remains within our hands. We still have so much left to play for, and I think today highlights the consequence of hundreds of people dropping their guard for very understandable reasons. We're all fed up with it. But this is a direct consequence of hundreds of decisions made on Friday and Saturday of last week, and the question now is how we manage this going forward. In terms of the landscape that we have today, so of the 1,400 or so positive cases, a third of those individuals were vaccinated with at least one dose, 7% were fully vaccinated. So again, we're seeing a disproportionate infectivity rate amongst the unvaccinated, with now less than 1 in 5 adults not being vaccinated, a significant skew towards the unvaccinated being far more vulnerable to the infection. We have, as I said, a quarter of the cases in the southeastern suburbs and the eastern suburbs, We have 2,661 cases in the west. We have 6,401 cases in the north. A significant drop in the proportion of cases in our northern suburbs, the areas we've been working on so closely over so many weeks. In terms of regional Victoria, we have 46 cases today in regional Victoria. I'll pick out the ones that are of probably most significance. 2 additional cases in the Trobe, and can I just thank the communities of Traralgon, Morwell and Moe and Warrigal for coming out in numbers over the last few days to get tested. Over 660 tests yesterday, just across Morwell, Traralgon and Warrigal. A really strong performance. A lot of additional testing resources put down there and some very busy queues, and my thanks to everybody for doing such a great job in turning that round. Only 2 new cases identified so far, both known primary close contacts, so that's an encouraging first day of that 7-day drive. Of course, another big couple of days ahead as we continue to work through that particular outbreak that's now at 24 active cases. We also have 4 cases in Warrnambool, all related to one household. We understand and we think the dynamics around there, but a lot more work to do, and again, additional testing facilities in Warrnambool today. We have 5 additional cases in Shepparton. 2 of those are known primary close contacts of an existing case and in isolation already. We have 2 cases in a separate household. We're just trying to nail down exactly the route of transmission, and 1 case we believe acquired from Melbourne, and again more work happening there. We have half a dozen cases in Moorabool, particularly around the Melton, and again we've seen that we're still seeing that transition between outer metro cases into Moorabool, similar to the Mitchellshire dynamic, where we have 12 cases today, 12 additional cases. 6 of those, half of those Mitchellshire cases already known as primary close contacts. The other 6 are being worked through, but again a number of connections back into Metro Melbourne. We have a scattering of other cases in other LGAs, which I won't go through. We'll have those in the Cho report for later on. As the Premier said, we're driving hard now on all fronts on the vaccination programme, and this is now, if it wasn't clear before, this is the critical route out of the pandemic that we're in, and now the wave is standing up higher than we would have anticipated. The vaccination blitz and programme becomes ever more important. As the Premier said, we've received, or will receive on Sunday, 88,000 additional Moderna doses. We are already deploying Moderna in some of the state clinics at this point in time, and we have currently Moderna available in the southeast at the Dandenong Palm Plaza pop-up site, so anybody can go along there and get access to Moderna. At the Sandown Racecourse Max Vaccination Centre, at the St Francis Xavier College at Officer, again there's a school pop-up site there, and at the Frankston Community Vaccination Hub. Those are all places where we are now running Moderna in our state clinics. Of course, the rest of our clinics continue to focus on Pfizer, and AstraZeneca remains available at all. But can I also just do a big thanks and a big encouragement to all of our community pharmacists. They've now done over 26,000 vaccinations through community pharmacy in your high street. And I think when Anthony was here last week, he spoke very well about the importance of the Moderna vaccine and the value it provides in its fight against the coronavirus. The Moderna vaccine, it's an mRNA vaccine just like Pfizer. It is safe, it is reliable, it is effective, it is used around the world, it'll be used around Australia. Please, the job now needs to be done. So wherever you can get a vaccine, whether it's a community pharmacy, at your GP, or through one of our many state clinics, please come forward and get the vaccine that's available to you. We're also opening up tomorrow a new mass vaccination site at La Trobe University at their Bundoora campus. That will be a 7 days a week operation, delivering at least 15,000 doses a week. It will be available on our booking portal from today, so you can book into that particular site and get access again, certainly to Pfizer and AstraZeneca. Please make those bookings and get your vaccination done. We're also running a pop-up. We've extended the Broadmeadows vaccination pop-up site on Widford Street. That was we're running hard last week. We did over just under 2,000 doses in the space of a week, and with popular demand, we've reopened it now again for another week to give more members of the community a chance to get their vaccination done there. There are, of course, many other pop-up sites now appearing across, particularly the western and northern suburbs and the southeast of our city. And can I again say, having achieved that 80% milestone, with 92% of over 70s having had their first dose, 89% of those in their 60s having had their first dose, we need to continue the lead that they've set and get those vaccination rates up as high as we possibly can. And of course, if your second dose is due, please get that booked in and let's get that the vaccination journey completed. Finally, in terms of testing, it's been great to see such a strong testing result today. And of course, we don't like to see 1,400 positive cases. We're glad we know where they are. We're glad we know that those people can get access to the clinical care and wider support that they need. They will, of course, get access to the isolation payments if they need it, as well, of course, as the test payment that's available to everybody who gets a test and who needs that bit of extra financial support. We have 2 new mass testing sites launched now in Pascoe Vale Road, in Coolaroo, and at Deakin University in Burwood, both 6-lane mass testing sites. Again, we are continuing to expand that testing capacity to ensure that everybody can get a test quickly, reliably, safely, so that you know where you are, so you can protect yourself and your family. Finally, we all know this is hard. This is hard for every one of us. But once again, I think we're at a key decision point as Victorians about where we go from here. We have to decide whether we're going to push on through the fatigue and get the job done. As the Premier has said, the goal is not that far away. At the end of October, we should get to our 70% fully dosed or fully vaccinated status, and that gives us all hope for a much better and a much cleaner future. But we need to get the vaccination job done in the next few weeks ahead. And that's a responsibility for all of us to complete our vaccination and encourage those around you to get vaccinated so that we can protect ourselves from the high rates of cases and transmission we're now seeing all around us. But we need to buy time to stop the transmission that's happening now. And this is no longer an issue for certain communities in some parts of our city. This is now an issue all across Melbourne. We now have cases in every LGA. We have cases in every suburb. So if you've been mixing over the last few days, if you decided to go to a grand final party on Saturday, if you went to a barbecue on Friday, I'd like you to go and get tested, because you don't know whether somebody there was harbouring the virus. And we now have at least 500 people who we know have had that experience. There'll be many hundreds more who went through some kind of social activity. We need to make sure that if you're positive, that you can protect yourself and isolate yourself and not spread it any further. We are so close. I know this is hard, but we've got to do that extra bit over the next few weeks just to get through this so we can move into a better future. Thank you.
Happy to take any questions you have.
Premier, given when numbers skyrocketed in New South Wales, it was a national emergency. Should even more vaccine be directed to Melbourne, given our numbers are skyrocketing?
Well, that's a matter for the federal government. We're pleased to have the 88,000 Modernas that are coming to us on the weekend. We had predicted that pharmacy, as good as they are, they wouldn't get them all into arms from a standing start. Anyway, they're coming to us now. We would have preferred them probably earlier, but they're coming to us now. And the reason I say we would have preferred them earlier, Rich, is that they've got a 4-week interval. So as hard as we'll work next week, not all of those people will get a second dose before the 26th of October. That's why we said 2 weeks ago at National Cabinet, almost to the day, look, give us some of the pharmacy stuff, because they, as good as they are, they won't get everything done. Anyway, that was a decision that was made. We're happy to have it now, but every jab that's done now and every second dose that's done now gets us a step closer to the lockdown being off. So we'll take any vaccine that's going, and we will try and get it into people's arms as fast as we possibly can. But when we ask for things, we ask for them for a reason. That's why all week, you speak to the Minister's office, no, speak to the General. You speak to the General, no, can't tell you till Friday. We've now finally basically got everyone saying yes, so that's why we've been able to announce the interval change. I would have preferred to have done that a week ago, but anyway, you can't change that. But I'm not going to get up and be declaring national this and national that. This is a global pandemic. We're so close. Let's all of us play our part, get vaccinated. There are appointments there, Rich, Pfizer, AstraZeneca, and there's also Moderna appointments. So go and get vaccinated, and anyone who gets vaccinated this weekend, anyone who gets vaccinated in the next week or so, there's every chance with these interval changes that you'll be able to get your second dose before the end of October and help us pull all those dates forward so that we can achieve our targets and maybe even bring them forward by a day or two.
In the past, you flagged putting trucks or buses at the end of streets in areas where the vaccination rates are low. Is that something that's still on the cards?
Well, I've got to say, we wouldn't rule anything out. We'll go door to door if we have to. However, I would just say this. We're very pleased to see, and it's not being boastful or anything, we're just very pleased to see the North and the West having responded so positively to the pop-up activity that we've done, to the big push. And a lot of it's not necessarily broadcast. A lot of it's very local. We've used trusted voices, local communities, faith leaders, cultural leaders, school leaders, all sorts of different people. And we've seen those numbers go up. Now, they still have to go up further, but they're coming off a much better base now. To be coming off a 70-plus first dose, we can be very confident that those areas where the outbreak is running hardest and kind of hottest, if you like, to have seen the turnaround there in the last few weeks is really, really good. And I thank everybody who's come along and got a jab, but also the people who've been running that program for us.
On today's numbers, in the health briefing that Professor Ewan Wallace gave us some weeks ago, he said 18,000 cases in 6 weeks. Does today's numbers and what's happened with those grand final parties, have we already reached that peak? Is the peak now pushed up much higher?
No. Look, I think the point Jeroen's making and the point I'm making is this. If we continue to see people just kind of, I so desperately want it to be over that I'll pretend it is, and I'll go to friends and family and I'll just ignore all the rules. If we see that continue, cases will continue to grow. And we don't have, no state, no part of the world has unlimited capacity to treat the patients that come from that. Now, look, hopefully we're not getting 10% of cases translated into patients, but there's a time lag as well. That's the other problem. Those who will finish up in hospital as a result of these 1,400, they don't finish up in hospital on day one after we find that they've been infected. It'll be, next week and into the week after. So we're not having to revise any of our roadmap targets at this stage. And I don't want to do that. I want to hit them. I want to beat them. I want to be able to. It doesn't yet because it's only one day. But what I'm saying to every Victorian, if we continue to see this sort of behaviour, we'll continue to see these sorts of numbers. And these numbers is not about one day, but if you get this each day, every day for a week, all of a sudden you're putting avoidable pressure on all sorts of different systems, most notably our public hospital system. And again, it's not just about ICU. Every COVID patient that's in a bed, in hospital, or indeed on a pathway where we manage people at home, they're not easy patients to nurse. They're not easy patients to care for. They've, after all, got a wildly infectious virus, and many of them become very, very sick. So no one wants to get this. No one should be doing anything to actually recruit the thing into their family. No, we've all just got to see this through for another few weeks, and then we can be open. The lockdown ends, and we can then each day take further big steps towards getting to a normal position. Normalising this. It'll be hard, it'll be challenging, particularly for our nurses, but there's no turning back now. We are pushing through, and we are going to go through these different difficult gateways, but getting vaccinated is incredibly important. And in the meantime, I'm just appealing to people, please try and make the best choices. I know how frustrating it is, and I know why people want to connect with the people they love and get back to something like normal. I understand that. But we don't quite have the freedom to do that yet.
Should we have cancelled the public holiday, though?
No, I think that grand final or no grand final, public holiday or no public holiday, I think there's a... Well, I'll put it to you. Do each of you know people who have been doing the wrong thing? I think we all do. We all do. And it's not a sense of blame or a sense of trying to single people out or anything like that. It's a fact. And part of my job is trying to be as clear with people as possible. And I'm just appealing to people. We can't change what happened last weekend, but please, we can't be having a repeat of that this coming weekend or for the next few weekends, because we are so close. We can see to the other side of this. And then the lockdown's off. We've got many more options. We get the protection of 70% double dose, pushing to 80% double dose, and hopefully going beyond that. And we can hit all of our targets, or indeed, perhaps meet some of those thresholds earlier. That's what I'm working towards every day, every night, every week. I just need people to work with me on this, and I know it's hard. I know it's for all the reasons that we've talked about so many times. But we can't pretend it's over because we desperately want it to be. That's not an option here or in Sydney or anywhere else.
Speaking of Sydney,
Yes.
You said you wanted to avoid a Sydney-style situation by going into lockdown hard and early. You acted quicker than Gladys, obviously. Now that we have recorded record cases, more than New South Wales, 1,438 today,
yes.
Cases climbing into the thousands, given that we are under some of the toughest lockdown measures, notching up a world record day spent in isolation, there's not much more that we can sacrifice. So Why do you think this lockdown hasn't worked, and what else can we do?
Well, I think if you talk to the Premier of New South Wales, she'll tell you that her lockdown's tougher than ours. I've had that conversation a number of times at National Cabinet. Not that it's a lockdown contest. Be very clear about that. Look, we don't have 40, 50,000 active cases, and we're going to try and do everything we can to avoid that. We're going to try and do everything we can to avoid that. I'm not here to make comparisons with New South Wales. We want to try and avoid the worst of this global pandemic being visited upon our state. So that's really not a comparison. That's just a point more broadly. I have at various points said we wanted to try and avoid what New South Wales has had to go through. And I remain committed to that. That's why I'm asking people, please follow the rules, please do the right thing, please just let's finish this off for the next 3 or 4 weeks.
But our case numbers over the last few days have surpassed that of New South Wales.
Yeah, but
and
this is
our
not a...
lockdown
But,
measures have been tougher than what they have in place.
well, no, that's not what the New South Wales Premier would say. You perhaps want to get your colleagues in Sydney to ask her whether she thinks she's got a tougher lockdown than us. She's made the point to me many times that she believes she does. In any event, this is not... I wish this was a daily event. Like, I wish tomorrow this was over, but it's not. So we can look at one day's case numbers. Yep, fine. It won't be over tomorrow. Like, it's a much longer run thing than that.
So do you think the lockdown's worked then? We're notching up world record days spent in isolation, so has the lockdown worked?
Well, we follow public health advice. And if you want to, on the one hand, urge that we open up, and on the other hand, to be critical about how many cases there are, those two things don't work. Like, that's just, there's no logic in that. So we can open up tomorrow, and I won't be standing here reporting 1,400 cases. I'll be reporting a lot more than that, and I wouldn't be reporting just a few people in hospital, 400 say. It'd be a lot more than that. There's a national plan. We're delivering the national plan. We're completely faithful to the national plan, as I'm sure New South Wales will say the same. And the national plan does not have us, to flip your question around, like, have lockdowns worked? Well, yes, because if we didn't have a lockdown on, it wouldn't be 1,400 cases today.
How are cases still climbing if we're locked down? This is the thing. How much more we
Well,
can't
look, with the greatest of respect, we're 21 months into this, and I think I've made that case many, many times. And I'm not going to go back over that. I think you know the answer to that, frankly.
If we do see case numbers continue to surge...
Look, no, let's be really clear about this. If anyone is putting it to me that we should have lockdown off with less than 50% of people double dosed, that's not the national plan. That is not the agreement. And if you're concerned about rising case numbers, well, then you'd be really concerned then, because it wouldn't be 1,400. It'd be a lot more than that.
If we do see case numbers continue to surge, can you rule out having to revise the roadmap?
No, I've never ruled that out. I don't. There's no crystal ball with this. But that's why I'm appealing to people. Why would you act this weekend to be locked down longer? Why would you make choices that, frankly, like, there's a lot said about, oh, well, people didn't realise, people didn't. That's nonsense. Like, seriously, that is just nonsense. It's been going on for 2 years. People know what the right thing looks like. They know what it feels like too. It feels bloody tough. But that's why you have to do it. That's why you have to do it. Just for a few more weeks. That's what I'm asking of people. Let's not make it more weeks under lockdown. Let's beat that target. Let's get there before the 26th. So there's two things to do in that. One, stay at home and don't go visiting people and take the virus with you. And two, book a vaccination appointment if you haven't, and go and get vaccinated and go and be part of that 70% double dose, hopefully before the 26th.
On the weekend, I think Jerome gave the stat, and I can be corrected, but I think it was 55% of Saturday's cases, or it might have been Friday's cases, were due to social interactions that were probably illegal. It was 45% were just...
Yeah, there's not many social interactions, certainly indoor social interactions, that aren't.
But 45% were inside households where a person was already infected. 55% were going into different households.
Sure.
Non-compliance has been an issue throughout this whole outbreak. Fatigue's been a problem the whole way through. Yes. How sure are you of the uniqueness of what happened on the weekend? I know there's been a lot of data presented by Jerome, but it's difficult to extrapolate data off interviews that happened late afternoon yesterday.
Paul, I don't think it's uniqueness. I think what we're saying is you've probably got the same phenomenon, but you've got it at a higher rate. So you've got more volume, if you like. So I wish that the first weekend where people were visiting each other was last weekend. I think that's been happening for quite some time. I understand why, but I also understand that I'll just say to people on behalf of nurses across the system, please don't do that anymore. because you're going to make the job that they've got to do much, much harder, because there'll be more cases and there'll be more people in hospital and there'll be more people that are really, really sick. So it's not that it happened for the first time last weekend. I think it's a trend that's been there for a while, and whether it's an iconic event like the footy or just the passage of time as well, like the fatigue, the whole notion of fatigue is that it gets harder the longer you are living under it.
If it's been there for a while and it peaked on one unique day, given there was a one-off event, and you've said over and over that it's totally understandable why people are acting this way, but then you've gone on to use quite critical language during the same press conference. What do you think the value is of highlighting it and being critical? Do you think that has an effect on behaviour? Do you think it's likely to have an effect?
Let's be very clear here, right? There's some talking points from the other side of politics. Apparently I'm too critical of people. No, I'm calling it out. I'm calling it out. Like, standing up here and saying, oh, it's all terrific, everything's fine, everyone's following the rules, there's 100% compliance. Like, that's not leadership. It's just nonsense. So, yes, you will see me call out bad choices, and I don't do it for the purposes of, like, justifying things. I'm doing it for the purposes of appealing to people. You can't change what's already occurred, but part of this job and part of getting to the other side of this is appealing to people to make better choices, because there's always another day, there's always another weekend, there's always another month until we get to 80% double dose, and we're so close to that. This is the key point. We've got to see this through, and I'm completely uninterested in those who play politics with this. I try and be as frank and as direct as I can be from this podium. I'm not going to change that. We all know people who are not following the rules, and we know, not as a matter of, we reckon, we've kind of guessed. No, we interview all these people, and they've told us that they've been visiting people. So it's not a theory to kind of divert attention from something else. It's a fact, and that's what we're talking about here today. So I'm just asking people, let's get out of lockdown quicker, and the best way to do that is to get vaccinated, and there's appointments available. And in the meantime, let's not contribute to more cases. Let's follow these rules. Let's follow these rules in their current form for just another 3 or 4 weeks, and then the lockdown can end, and that'd be a fantastic outcome. Fantastic outcome.
Is there evidence of them being?
Sorry. Were any of those people protesters?
Not that I'm aware of now, but we'll look through that, and if there's a trend there, and that's what we're doing. We're talking about sort of trends, if you like. If there's anything that we can update you on, then of course we will. But I don't have a briefing that they were. And again, to a certain extent, if you're protesting, some of whom don't believe this virus is real, some of whom have now got it would seem, and some of them are indeed sick. I'm sure it's not a big leap of logic to think that some of those people probably haven't come forward and got tested.
Yeah, just following Steph's question, do we have any further evidence on how much the protests have contributed to these current cases? I know
No, not that I can speak to now, but and I would have thought that. I'll put it to you this way: if in case interviews people were telling us they'd been to the protest, I'd be standing up here saying it. I've made my views on those protests very clear. Couldn't have been clearer. I'm sure you would give me that. If we have more to report on that, if it starts to become clear, then we will speak to that trend also. But the trend that's not necessarily a trend that's clear yet. The trend that is clear is people actually in their interviews telling us, yeah, well, you better go and get all them tested, because I went and visited with them last Saturday, and I understand it, but we've got to stop it. We can't do it. Just 4 more weeks. Just push. We've got to push through, get to 70%, then get the lockdown off, and then we all have options that we don't have now, because we have protections that we don't have now. There's a massive difference between 49.5% double dose protection and 70% double dose. A world of difference. And then, of course, when you get to 80, it's even better still.
Premier, have you got the plan for regional schools? When will the regional...
Pardon, sorry?
Plan for regional schools.
I think you'll find that the Deputy Premier will be speaking with regional communities today about that. So I think that's a focus for regional communities, and I think he'll be speaking directly to them about that.
And on the regions, I think you mentioned 4 cases in Warrnambool. The hospital down there saying they've already got 12. So just seeking a bit of clarity on that.
We're happy to chase it up.
And is Greater Warrnambool looking at a situation similar to Latrobe Valley, that there'll be a lockdown announced?
Not that I don't have advice to that effect.
Does it happen very rapidly on?
Well, and it does. So what I was about to say was I don't have advice, but the moment I do, we won't hesitate to make that choice. But I don't have that advice now.
Will today's numbers change when we trigger the surge capacities in our hospitals? Things like calling off elective surgeries, moving them around. Does it have any effect there?
Well, not a single day, no. But I think if you continue to see this sort of trend for days and days and days, then we have to assume, because the data tells us that you'll finish up with a percentage of those cases, they'll ultimately finish up in hospital. Not everybody in an ICU bed, but there will be, and it's bounced around a bit, and there's been a bit of reporting and commentary on whether it's 10% or 5%, you know. Ultimately, even at 5%, the more cases you have, the more hospital admissions you'll have.
How likely are we to keep it to 1 day, do you think?
Sorry?
How likely are we to keep it to 1 day when we have seen such an exponential growth
I'll
overnight?
be best placed to answer that tomorrow and the day after. I hope that we see, you know, a few days that's kind of the result of last weekend, and that hopefully this weekend people are making different choices. Like, I get it, I understand it. No one is enjoying this. No one wants this to go on for an hour longer than it needs to. We've just got to get to the other side of this. And the good news is we can see it. We can see the 26th of October. We can see 70% double dose, and we might even be able to bring that forward a few days. Let's not any of us do anything that puts that at risk, and let's not any of us do anything that will make the job of our nurses harder.
I think the Burnett modelling said that if we go into that October 26 period at 1,500 cases, or at an average of 1,500 cases for the week leading into it, the chance of hospitals being overwhelmed rises significantly, and it's very much about the numbers as we enter that period, because then cases will...
Yeah, you want less cases rather than more. So the more people you got in hospital when you open up, the harder it's going to be for everybody.
If we're still rising at that point, and there's already pressure on our hospital system now, 2 or 3 weeks' time is clearly going to be much more dire.
Paul, there's pressure on our hospital system every day.
Yeah.
That's the nature of our hospital system.
What do you think you'd need to see? How dire would it need to be in middle or late October for you to delay that reopening?
I can't give you an answer to that question now, other than to say this: we are not turning back. This is a plan to open. We have
we could turn back.
We are not turning. As I stand here now, we are not turning back. We are finding a way to push through and get this place open. We've got to do it. This is a plan to open up. However, it would be irresponsible for me to say that we wouldn't, for instance, have to pause. We wouldn't have to modify things. We can't. It's not sustainable. It is not sustainable for people to act like we've hit 70% double dose when we've yet to hit 50% double dose. So going and visiting friends potentially puts everything at risk. That's why it's so important. If it was unimportant, I wouldn't mention it. And I wouldn't want to be given the impression that I'm, lecturing people. But this is an important part of the job I've got, to be as frank and direct as possible. And some poor choices have led to these case numbers today. Can't change that, but we can change what we do tonight and tomorrow. And for each of the days, hopefully only, 4 weeks or so, between now and when we reach that 70% double dose target.
Is there any health advice around returning regional Victoria into a lockdown? The cases, the 40-60 ones today, aren't just confined to Warrnambool, the southeast. They're in the north, they're in the east as well. They're everywhere. We
look very closely every day at those numbers. I've got no advice about that. But to Rich's earlier point, it can turn really fast. I'm not wanting to scare people. That's just the nature of this. But no, I don't have any advice around locking down any other areas of regional Victoria.
And what's the health advice around closing toilets and amenities for golf clubs and tennis clubs, which I think reopened yesterday?
Yes, and I believe that the public health team are having a look at that very issue. Hopefully can resolve that positively.
As in it's going to be reopened?
I've asked them to have a look at it. They are looking at that very closely, and hopefully there'll be some positive news soon.
Is there a worrying trend of the public health team drafting public health directions that quickly get reversed because they're totally impractical? Does that undermine the confidence in
Well,
that team?
they're doing their best, Paul, and I don't know that necessarily... If you're a golfer, then perhaps having some conveniences opened way out, and the furthest reaches of the golf course are very important to you. Yes, I understand that. Serious. That's why I've asked them to have a look at it. I don't think that's necessarily something that every single Victorian would be particularly concerned about. So no, I wouldn't draw the inference that you've drawn. That team works as hard as they possibly can these directions are a good deal more complex than they might seem sometimes. But the good news is there's a query been raised, being followed up, and hopefully there can be a positive response to that quite soon.
Can the GAT go ahead next week as planned?
Yes.
No.
I've got no advice that it won't. So we are planning 5th. Yeah. Yep.
And just perhaps a question maybe Jerome might be able to answer, just about getting the vaccination status of those in hospital.
Do we have it of those?
In hospital.
No, I don't. We can let's get that for you. We'll try and do it for you for the show release later on today.
And just some clarity with the cases today. Did you say that some of them are vaccinated? I mean,
Yeah.
We'll get a breakdown of that, please.
Yeah, we will. We'll give you a breakdown. We'll give you as much vaccination data as we possibly can of those that are in hospital. I don't think it'll be an issue of actually identifying anybody, but it could at some point in the future get down to like a single person, so we have to be a little bit careful with that. But I think we should be able to give you, if we have it, if we know it, right, so there might be a bit of a lag, first dose, second dose, no doses, and we'll give that to you for as many people as we can, cases as well as people in hospital.
How are you looking at plans for a dedicated COVID, maybe a field hospital or somewhere just for COVID patients to take the burden off the...
There are, just be clear, there's nothing easy about pop-up, like we do pop-up vax clinics, we do pop-up testing sites, pop-up hospitals, much, much harder. But there's all sorts of contingency planning that happens, all sorts of contingency planning. But, the most important thing here is to acknowledge that there are many different ways to provide treatment to people. For some people it'll be at home, for some people it'll be in a general ward bed, for other people it'll be in a high dependency unit bed, others it'll be an ICU bed. Some of them will be on an ECMO machine, a heart-lung machine, some will be on a ventilator, some won't be on a ventilator. Some people in ICU don't need that level of care, but they still need intensive care. So there'll be lots of different patients treated in lots of different ways based on their circumstances. I just again make the point that the public hospital system is built around one key principle. The sickest patients get treated quickest. So that will mean other patients, if we have many, many more very, very sick people with COVID, then they will have precedence over others who can wait. And if it was your son or your daughter or yourself that was very, very sick with COVID, that's how you'd want the system to work. But there's all sorts of contingency plans, lots of hard work going on, and I'm grateful to all the people that are doing it. But whether it's a field hospital or it's an expansion or using parts of the hospital that wouldn't normally be used or whatever it might be, I'm sure that we're no different to New South Wales, where they're looking at every single contingency.
Should there have been a greater police focus on the weekend on compliance among mainstream Victorians going to illegal gatherings?
It's incredibly difficult to police backyard barbecues and people having, sometimes only a very small group. Sometimes it's only a very small number of people that might be not all big groups, don't all have to be 20, 30, 50. Might only be just one family coming to visit you, and unbeknownst to them. And I'm not for a moment kind of alleging that people are willfully spreading the virus, but people can rationalise all sorts of things, can't they? I'm fully vaccinated, or I've had one dose, I feel fine, we'll just duck over here, spend the 3-4 hours, it'll be fun, it'll be terrific, we've earned it, and then 2-3 days later, everybody's got it. So there was a gathering down in the Latrobe Valley. The number of people, like the knock-on, the number of people who are now close contacts, it's growing by the day. It's huge.
Just on another issue, the major supermarket chains are saying that they're going to have to close stores as soon as this weekend as a result of staff having to isolate. Coles and Woolies are saying they've collectively isolated more than 29,000 staff due to exposures in New South Wales and Victoria since the Delta waves began.
Yep. And
not a single transmission has been identified as arising from those exposure events. Do we need to reassess our protocol for isolating people so that we don't have empty shelves?
I have not been briefed on where that's up to. I'm sure there's been lots of discussions going on. I've been rather taken up with other things, but I don't for a moment want you to read into that it's not important. Let me have someone come back to you in relation to... Look, what we've seen, for instance, some of our furlough protocols in hospitals, once you start getting people double vaxxed, they change. And I think some of the things we did, New South Wales are now doing that too. We have been very focused through... I've personally had a number of meetings with all those big supermarket players around getting their staff through the first and second jab. That's been our focus, to keep them safe and to protect them. But it may well be that a furloughing protocol, like a different ISO protocol, is possible. Let me find out exactly what's going on there, and I'll have someone come back to you with what we're planning to do about it. We want our supermarkets open. And having said that, I'm not encouraging anyone to go out and panic buy today. There's simply no need to do that. We've got a very, very close relationship, and we're very grateful to Aldi, Coles, Woolworths, Metcash, all of them. The very, very close working relationship with our government, as I'm sure they have with other governments, and we've worked very closely with them, and we thank their staff. They've done an amazing job.
I mean, if they're looking at imminent closures of supermarkets, that's something you're going to have to address pretty soon.
Well, they certainly haven't picked up the phone, and given the relationship, I'm not aware of them having voiced that concern to us. But
meetings with the government yesterday and today, and that they feel that their concerns are falling on deaf ears.
Well, I've spoken to the CEOs and senior people in all of those businesses, and they know where I am and how to talk to me, and none of them have rung me to say that. So let me get into that, and I'll come back to you. The mere fact that we've had almost constant engagement with those businesses for 20 months more now, I think we know and understand how important it is. We've been vaccinating them like there's no tomorrow. Let me get into that, and I'll be happy to provide an update to you.
Department of Health failed to provide a safe workplace in hotel quarantine last
Sorry?
year.
On construction, can you give a definite answer that the 2-week shutdown is the 2-week shutdown?
I can't provide that definitively, but it's my hope that relevant ministers will be out tomorrow, hopefully, to provide some clarity for that industry. And not just about reopening, but a pathway to being well above 25%. But I just make the point that it's incredibly important that everybody in that industry knows and understands that we're going to be taking these issues seriously, and let's get them open. Let's have them expanding over time, growing back to 100% over time. But let's make sure that we do everything as safely as we possibly can. That'll be the biggest determinant as to whether they stay open and whether they can go from 25 to 50 to right back to getting as close to 100% as possible.
Have you found a way to try and track how many are actually vaccinated yet from the construction?
Well, I think the Minister will speak to that tomorrow.
Premier, WorkSafe is prosecuting the Department of Health for up to 58 charges over the alleged safety failings in the hotel quarantine system, potentially fines of up to $95 million. So how will relevant individuals and people be held accountable, and why should taxpayers foot the bill for this?
Well, WorkSafe is independent, and there's a court process on foot, so I'm not going to be commenting on that. That's before the Magistrates Court.
Can you provide any information right now? I mean, can Victorians...
No, I can't, because I'm not going to be running a commentary on a court process. It's before the Magistrates Court. WorkSafe are independent. I think they demonstrate that every day with the work that they do. So I'm not in a position, not today, and not any day, to be commenting on matters that are before the courts.
But taxpayers are footing the bill for this one, so do you
Well,
have any...
there's a lot of legal action that occurs involving the government, and I don't comment on that either. So I'm not commenting on it. I've made it very clear to you.
No one's asking you to comment on the evidence, the substance
No,
of the
but you are,
evidence.
and I'm
No, they're not. The question was
Well, with the
around
greatest
government.
respect, Paul, it's not for you to reinterpret what other people ask. If you want to ask me a question, please do so. But I'm not going to get into a debate with you about what someone else asked.
Without going into the evidence of what the court will hear,
Yes.
which would obviously put you in contempt of that court.
Well, no, it wouldn't put me in contempt at all.
It could.
Well, no, that's not the case. Look, I'm not a lawyer. I don't know whether you are, but we can go toe-to-toe if you like. I'm not commenting on things that are before the courts. And part of question and answer is that I don't know what your next question will be. So once I start answering some of them, who knows where we'll finish up? We'll finish up essentially running the case at a press conference.
Would you judge the
I'm
question
not
on
doing
their
that. I'm not doing that. I judge all your questions on their merits, and I answer them appropriately. And I will not be going into the details or canvassing issues that are currently on foot, live, being dealt with.
Okay, what about the Coate inquiry? Can I just get you to reflect on Coate's comments blaming a proper lack of leadership and oversight for the infection outbreaks, describing the program as a catastrophe waiting to happen? Can I get you to comment on that?
I've already made my comments very clearly on that particular matter at the time and since. and we've been acting to deliver on all the recommendations that were relevant to us as handed down at the time. You can go back and have a look at the tape. It's very detailed. I went through and spoke at length about that process.
Sorry, separate to what's before the courts, the health department will either be found guilty or it won't. If it is found guilty, it will be fined. That money, does it not, either has to come out of the budget of an already struggling health system, or you guys top it up one way or another. Why should Victorian people and Victorian taxpayers and users of the Victorian health system be punished for the mistakes of individuals in the health department rather than those individuals?
Well, you've just canvassed all the issues that are relevant. You can't divorce any of those issues from what's on foot at the Maggies now. So I'm afraid I'm not in a position to speak to that. It's an independent regulator. They take their responsibilities very seriously. There's a court process, and let's wait and see how that unfolds. You're wanting me to assume that there'll be findings of guilt, that there'll be penalties issued, that there'll be all of that, and I'm not in a position to do that.
But do you believe in the principle? Do you believe the principle is fair that taxpayers will foot the bill for any fines?
Well, in principle, if penalties are issued, and penalties there are penalties issued against the government, there are awards made in favour of the government on a fairly routine basis, Rich. Let's deal with that when and if it happens. When and if it happens. But the government doesn't get to say, well, actually, we don't like that judgment, so we're not going to do it. We're not going to. These penalties have been duly issued, and we're not going to pay them. That's not how it works.
If a private business owner is
That isn't how it works. Directly to the point about a private business, they don't get to say no, and nor does the government.
But if a private business is exposed to this kind of court action, their whole livelihood is potentially on the line. That's not the case for the people who made these decisions.
Well, because because the Department of Health and a private business are two very different things, Rachel. Two very different things. The Department of Health is not, for instance, for profit. The Department of Health has a degree of responsibility that is far broader than any private business. So that's not really a fair comparison. On the issue of principle, to Rich's question, and please don't spend the next 4 days thinking about reframing all these questions as matters of principle, because that will just see us back where we were a moment ago. It's in the Maggies. Let it run its course, and we'll talk about it when it's finished. But as a matter of principle, the government is not exempt from sanction or from penalties or a department or a agency. That's a obvious thing, and there's lots of different actions, lots of different things that happen, either in favour of or against the interests of an agency or a government department, and that doesn't mean that you get to say no, we won't be doing that because we're part of the government. That isn't how it works.
Are you concerned that dirty laundry of the Labor Party is going to be aired in IBAC in a couple of weeks when the Adam Sonirek matter becomes public?
As I've said a couple of times today in relation to a different issue, that's a matter for IBAC, just like the other matter is a matter for the Magistrates Court. So no, I'm not going to be. Well, so let me make. There's that point, which I think I've made. Secondly, the answer to your question is no. That's not something of concern to me. I'm far more focused on getting us to 70% double dosed and having the lockdown off, Rich. That's what I'm concerned about, morning, noon and night.
Commonwealth is stripping away financial support after 80% or a couple of weeks after 80%. Where does that leave the many Victorian businesses who'll still be operating with pretty strict restrictions on them after that? And do you think it's the right move by them?
Well, I think that we're disappointed that this kind of blanket, there's no more support after 80%, when the national plan actually talks about targeted lockdowns potentially being part of the post-80% world. Like, not the whole city, not the whole state. I think it's a very simplistic and quite a binary view, and I don't know that it's not borne out by the national plan, and it may not, I stress, be borne out by what the epidemiological realities on the ground at that time.
So what does that mean? I mean,
I certainly hope that there's no business support needed after 80%. That'd be terrific. But, stomping your foot and saying there shall be no more payments made, that's not leadership. So the federal government's up to, but it's not leadership. We don't have unlimited resources. I think you'll find that the Treasurer and the Minister for Business Support and others will speak to that tomorrow. We're always pleased for a partnership, always. We're pleased to work together. That's what's most important, and I communicate that routinely and often to the PM, that working together has arguably never been more important. That's what we are focused on. But that's sometimes tested. The Commonwealth Government often form views. They don't necessarily come and ask us what our opinion is, and they're entitled to do that, but we're also entitled just to say, look, let's hope that's the case. Hopefully there's no business support needed when we get to 80%, but I suspect there might be some. So ruling that out, that doesn't serve anyone's purposes.
Why don't we have an answer as to who was responsible for hiring private security following the Coat inquiry?
I've dealt with all those issues and I don't propose to deal with them again. I direct you to the inquiry and I direct you to a whole bevy of commentary that I ran and answers to questions after that.
Now, I guess with Victoria's OH&S Act saying that any person who manages a workplace must ensure reasonable practice to ensure the workplace is entering and leaving it as safe. We've spoken to people that worked there on the front line. They're feeling that their safety has been compromised. So, yeah, what do you have to say to that?
Sorry? Has or is compromised?
Was. There's the security guards that were put on the front line.
Yeah.
Obviously, their reputation
A year
was
ago,
tarnished from that
I'm not
sector.
here to add to the answers that I've already given. And with the greatest of respect, I fully acknowledge that I don't know that you were necessarily at those press conferences, many of them.
I followed
but
it last year.
yeah, sure. And well, then you'll know that I don't need to, and I'm not going to add to those comments, as I've made very, very clear.
Just on the bringing the Pfizer supply forward, what assurances did you receive from the feds that enabled you to do that?
The Pfizer interval.
The Pfizer interval
sure.
forward. Yeah, what assurances did you
Well,
receive
there was
that you hadn't been?
Yeah, well,
been
there was a
getting for
bit
the
of back
past
and
week?
forth all week. So this is the normal dynamic. You ring Minister Hunt's office, he tells you to talk to General Fruin. You act on what General Fruin tells you. General Fruin said he wouldn't be able to confirm the 4th week of October until tomorrow. Turns out, back and forth. I'm very grateful to all involved, but we've been able to get everything that we were going to get tomorrow. We've got that today, so we, as confident as you can be, subject to the plane landing and all of those or the ship arriving or whatever it is, we're now confident that we have everything that we needed.
The message for more than a week, though, has been that even if they couldn't make that official guarantee, because they generally don't for a 4-week period, is my understanding that there was no reason to believe that.
No,
that
the
dose
message for the
wasn't coming.
no, Rachel, that's not right. And whoever's telling you that is misinforming you, actively perhaps. The message for a week has been talk to the General. We've talked to the General, and the General has said we'll be able to give you what you need by way of confirmation Friday. We were happy to wait till Friday because it's only tomorrow, right? We've now had a flurry of newspaper coverage and the Federal Health Minister's had lots of views on these things. So we've said, okay, fine, if that's not right, then update us. If you can give us the certainty that the General told us we wouldn't get till Friday on Thursday, terrific. That's a great outcome. That's what's occurred. And now we're up here today announcing that from the 4th, the interval will be 3 weeks.
What did you get today? What was the confirmation you got today?
Well, we got the confirmation that we were told we weren't going to get until tomorrow.
Fruin confirmation today.
Sorry?
You got the Fruin confirmation
In
today.
essence, yes.
What do you mean in essence?
Well, I don't know that someone actually spoke with the General, but we've been assured by the Commonwealth Government that what the General was indicating we couldn't have until tomorrow, we can have today, and we can operate with that certainty. Should it get to this? Probably not. But, Rachel, when we speak to the Federal Government about any vaccine-related issues, whether it's the Minister's office, the Prime Minister's office, the Prime Minister or the Minister even, the answer is speak to General Fruin. So we do that. So then it's not, I don't think, disingenuous. In fact, it's absolutely appropriate that when he tells us things, we act on those things. And we take them to be the position.
Now that we do have this assurance, is it fair to say that supply is no longer an issue from this time forward, provided
I'm sorry, that's not the case. And this notion that we've got everything we need and 500,000 more and all this sort of stuff, that's just nonsense. It's not just about what you get; it's when you get it. We are in a race. I know a lot of people don't like to use that term, but we are in a race because the vaccination numbers that's when we get to end the lockdown. So it's not just about what you get, it's about when you get it. So that's why I raised the issue. I asked for what we boldly predicted would be underutilised Moderna out of community pharmacy. We asked for that 2 weeks ago, because if we got it 2 weeks ago, we could get it into people's arms in the intervening two weeks. We're getting it on Sunday. We're grateful for that. But if we got it 2 weeks ago, it'd be in people now, and we'd be 2 weeks closer to second doses. So you see the point I'm making. We're in fundamental agreement. Yes, what you get is important, but when you get it is pretty important too, because it's all about timing.
So can I just clarify, back on Paul's point, that assurance you got that last night. Who was that from?
Oh, I don't know.
Was it a phone call?
Well, it's hard to know, mate. It's hard to know, because 1 minute it's the generals running it, the next minute it's the minister running it. 1 minute it's wait till Friday, next minute you open the paper and it's, should have happened a week ago. I'll leave it for you to work out what's going on here. It's very hard to follow. But we have now, my officials have sufficient confidence to advise me that I can stand up here today and make the interval announcement. So that's what I've done. That's what I've done. And if you think you're tired of these games, welcome. I'm pretty tired of it too. Back and forth and back and forth. Give us what we need, when we need it, and we'll get it into arms. That's what we have demonstrated. That's what we've demonstrated. And I'll just go back to my earlier point. How some of these people, some of these federal ministers, have got the time to do this. It's beyond me. It's beyond me. Like the amount of backgrounding, the amount of briefing, the amount of texting, the amount of... Like it's the equivalent of doing like 3 of these press conferences a day. I don't know how they do it. There must be more hours in one of their days than mine. Anyway, less games, more jabs. That'd be the go. That'd be the go, wouldn't it?
Can I ask Jerome a couple
Absolutely, you can. I didn't come here for anything other than to be frank with people about these case numbers being too high. So before anyone writes any nonsense about diversions, I'm not. That's not. You asked me a question. The Victorians are sick and tired of these vaccine wars. I certainly am. Let's just get the jabs in arms. But if we're told to deal with the general, we deal with the general. I would have thought that's a pretty logical thing to do. He's a good guy, working very hard, very, very hard to get this job done. Jerome, you got a whole lot of issues for Jerome. Very good, thanks.
Jerome, some people are saying it's taking quite a while for them to be released from quarantine, more than 14 days, and they can't get onto the department. What's the lag in that department?
Yeah, look, I think, certainly using yesterday's data, Chanel, we had around 13,000 people released over the previous 7 days as primary close contacts. Today we have, with all those additional cases we've been talking about, we have around 30,000 people doing isolation as primary close contacts. I know that there's been, certainly when we had the issue that Kate, I think, discussed with you a couple of days ago, where some of our test results were a little bit late from one of our pathology providers, that would have led to a delay of about a day or so for a significant number of people. Apologise for that. That was frustrating all round. But I think on the whole, the team's up to date with it. What we ask people to do when you get to your day 13, you'll get a message from us, a text from us. You'll be asked to take a final test. You'll get a negative test result, and then you'll be automatically cleared by another text message from us. And we'll continue to find ways of simplifying that process.
And on exposure sites, there's roughly 600 at the moment. We've got 11,000 active cases. Are we behind in exposure sites? Should there be many more?
No, again, I think as Kate's explained over the last week or two, I think we are taking a much more focused approach on those priority exposure sites, the ones we're concerned about. So absolutely, when we were dealing with 20 cases a day, we would list far more depth around potential exposure sites, tier 1s, tier 2s, tier 3s. Increasingly in Metro Melbourne especially, we are focusing on those tier 1 exposure sites, the ones that we think there's a genuine high risk of transmission. It relates a bit to Rachel's question from earlier with the concerns that Coles and Woolies and others will have around having lots of their places. Everyone goes to a supermarket. Listing every single supermarket in Melbourne doesn't actually help us really track down the virus in a very intelligent way. So we are much more focused on those high risk sites. That does mean there'll be a smaller volume of the ones, but the ones that are there are important. What I will say, in regional Victoria, where you've got low case numbers, we continue to go through a more granular process. We've got the capacity and the bandwidth to do that, and I think it's also relevant for regional communities when you're at a far lower level of cases to focus on that.
And on the cases from overnight,
yep.
Are there any specific stories within them, such as large gatherings that you found from grand final that you can tell us?
Yeah, look, I think it's more about the scale of the story now. Given you've got 1,400, it's hard for me to keep 1,400 stories in my head. But yeah, this is a cause and effect issue. What if we ever needed a really good example of what happens when there are hundreds of mini super spreader events on 1 or 2 days, and what the result is? That is what today is about. We can see exactly a load of activity on Friday, Saturday. As I think Rachel said earlier, not massively different. It's still household to household transmission, but in a different nature. We've seen more social gatherings, more people getting together to watch the grand final, more people from multiple households doing things together. That's what our interviews are telling us, and you can see the scale of it 4, 5, 6 days down the road.
Did you interview them? You don't interview all cases on the same day, right?
No.
Some get interviewed 2 or 3 days
That's
later.
right.
So how were you able to determine the proportion of yesterday's 1,400 cases who were at social gatherings?
So we're always up to speed on our interviews. We interviewed, I think, around 1,300 people yesterday. During the course of yesterday, there'll be some interviews during the course of this morning. So I'm taking a proportion of those interviews that we've done and the narrative that comes out of those interviews, what the data is telling us in terms of the 60% or so in some parts of the city that we're seeing of new households being activated, the greater spread on the east and southeastern suburbs, the mobility data when you've got up to 25% uplift of movement on Friday and Saturday compared to other weekends and lockdowns. All those things together, Paul, tell a pretty compelling story of what's going on.
So you interviewed 1,200 yesterday, but many of them weren't yesterday's cases that are in today's numbers. They're previous days.
No,
cases.
they're the 1,200 people that were put. So as people turn, so let's talk about today. If you turn positive today, one of our contact tracers will contact you today to say, let's talk about your story.
That
Yeah.
very short initial interview.
That short initial interview to say, where have you been? What is your connection? What else can you tell me about your interview? Now, absolutely, that work goes on till about 10 p.m. at night. We tend not to phone people after 10 p.m. at night. We'll pick those up in the morning when those late cases come through. For the one.
Essentially day two then of when you've been picking up. So you've got the initial people of who've said, yes, I got sick and I had people over.
Yeah.
And this is the flow on of the post.
No. This is the first. So the cases we're picking up from yesterday, and a little bit from the day from before. But yesterday was the big spike day because we can see it. We can all see it in the numbers. Yesterday was the first day we were seeing significant numbers of people coming forward in both the geography and the nature and the profile of those cases and the very different demographic of those cases. And then the interviews are telling us from yesterday, and again they'll be continuing those stories this morning, what happened. I went to a party with some friends on a Friday or on a Saturday night. This is what I did. It's building a picture. And we've got those events happening from Warrnambool all the way out to Traralgon. We've got them happening all across the metro area. This is not one or two, to Chanel's point, it's not one or two isolated stories. It's now a picture of multiple of these kind of events. And I think for all of us to recognise that this is how the virus works. It's a very simple cause and effect story. Get a lot of people together around different households, around different tables, you will see the consequence 5 or 6 days down the road.
Did you find there were notable increases where there are kind of active younger demographics,
Yeah.
maybe South Yarra, St Kilda, I don't know, places like that?
Well, look, we certainly, and if you look at the map, what we're seeing is a much more significant spread of, particularly as I said, into the east and the southeast. We're seeing that map fill out. But one of the things that's made this outbreak distinctive over the last 4 or 5 weeks has been that it's been so heavily concentrated in those postcodes. So time and time again, we stand here and we talk about the Coastburns, the Craigieburns, the Roxburgh Parks, the Broadmeadows, really well-defined locations. Suddenly the map has bloomed, and I've got all sorts of suburbs. I've got cases in Bayside, I've got cases in Mornington, I've got cases in Dramana. I look at my mobility data and I look at the sheer activity that was in those areas on that weekend. It tells a very compelling story.
How much did the mobility? How much did the movement go up around the city on Friday and Saturday? Mobility?
So normally we would be at around 40-45% of normal traffic volumes, given we're in lockdown at a weekend compared to the normal baseline. So 100% baseline, normal weekend, no lockdown. Our weekends at the moment are running at around 45%. We saw 59% mobility on the Friday, Saturday and Sunday of that last weekend.
On all 3 days, or was it slightly different?
On average, across the 3 days.
Are you guys able to send us some of those?
Sure, yeah. I can show you a map if you like. I mean, if you look at, and again, you break it down by suburb and by postcode, and you can see that we saw more movement down the Mornington Peninsula on Friday and Saturday. And again, we all know this. This is bearing out the anecdotes that we all hear about people doing a few more things. Well, those anecdotes are not only true because we can see it in the data, it's true because we can see 1,400 cases today. So this is no longer other people doing other stuff with their virus. This is now something that's happening in every community in Melbourne. And this is what widespread community transmission now looks like. So it's It's a wake-up call for us because it's not someone else's problem anymore. How this goes over the next 4, 5, 6 weeks is down to how we all behave and what decisions we make. Getting vaccinated is an amazing thing to go and do. That massively reduces the risk of being part of this, but still, 7% of today's cases are double vaxxed. Doesn't make you immune, just reduces the probability by a massive amount.
To what extent do you think the fact that such a large proportion of the population is now fully vaxxed is playing into this, because they, rightly feel that they personally and other fully vaxxed people they're interacting with are at much lower risk than they previously were?
Yeah, look, I think there's absolutely a part of that. Recognise though that still only half of adults are fully vaccinated, and I think there is a general feeling of the weather's getting better. Where the end is in sight. I've done my first vaccination. I'm getting close to this. We can probably take it a bit easier now. Well, COVID's just slapped us all in the face again. And so when you do that, when you drop your guard, it comes back hard. And if it comes back hard, and if we let's hope that this is a one-off. Let's hope it's a one-off bad weekend that we had. The numbers will bumble along for a bit, and then hopefully we can try and cool them off again and get that curve back down again. Because if you look at the ref rate over the last 5 or 6 weeks, we had it down a few weeks ago. We forced it right down to about 1.2, and now it's flaring back up again. That is down to how we collectively act.
Earlier you said that you wanted everyone that attended a grand final gathering to get tested.
Yep.
Is that regardless of symptoms?
Yep, absolutely. I think if you went to a grand final gathering in Melbourne over the weekend, I'd like you to get tested. Absolutely.
Just on the Mornington Peninsula, you said that you saw a rise in cases there. There's also quite a few exposure sites that aren't listed publicly yet. So I guess what's being done to limit potential trains of transmission there?
Well, I mean, again, our normal contact tracing thing kicks off. So we contact the positive cases, we contact their primary close contacts, we work through them, we try to isolate them. That's why we've got 30,600 or so primary close contacts. And whereas, to the earlier question from Chanel, where there are significant exposure sites that we think are a real risk of transmission, then we list them.
Have you heard any details about an outbreak at a rooming house in Balaclava?
Not on my radar at the moment, Paul. Any other questions? No? Thank you all.
Thanks very much.